are you going, Mr. Jones?
Good, thanks.
That's good. Now, because of the AF you have, the arrhythmia, doctors ordered a daily ECG just to make sure while you're in hospital and you're not on the same medications that you usually are. So we're just going to do that ECG if that's all right with you.
No worries.
Good. Now, before I start, I'll just double check your name and your date of birth. Mr. Jones?
Tom Jones, 2nd of the 2nd, 1975.
Great. I'll just check your wristband. Beautiful. 5, 6, 7, 1, 2, 3. Perfect. That is matching perfectly. So I'll just grab the ECG machine. We will get you to stay in that lying flat position just for a few more minutes. It won't take very long. So I'll just grab the machine. Okay. All right. Now, before I start, I just want to double check you don't have any chest pain at all right now.
No.
Good. Okay, then I can just make sure that this is classed as just a routine ECG. I'm just going to turn it on and let it warm up while I put your dots on. Okay, I'm not going to get you to get undressed today, Mr. Jones. I'm just going to put the leads that I would normally put on your arms and legs on your abdomen and your chest to make it a bit easier for you. Okay, so no chest pain. I'm just going to put my V1 lead on the right hand side of your chest on the 4th intercostal space on the sternal border. So 1, 2, 3, 4. So it's just on the border of the sternum there on the right hand side. And then I'm going to put V2 exactly the opposite on the left hand sternal border in the 4th intercostal space. So 1, 2, 3, 4, and right on the border of the sternum just there. Okay, I'm now going to jump to V4 lead. So I've got 1, 2, we'll jump 3 and we'll go straight to 4, which is the mid-clavicular line, so the middle of the clavicle, and we're going to the 5th intercostal space. So 1, 2, 3, 4, 5. We're going to the 5th intercostal space here. And then I'm going to jump to number 6, which is actually the mid-axilla, so the middle of the armpit, but also the 5th intercostal space. So 1, 2, 3, 4, 5. So it's in line with V4. Now we put V3 and V5 in the middle. So we put V3 in the middle of V2 and 4 on the 5th intercostal space, and we put number 5, V5, in the middle of 4 and 6 on the 5th intercostal space. So they are all on the 5th intercostal space apart from the first 2. And now I'm going to put your limb leads on. So we would normally go, the leg would be on the inside of the calf, so keeping away from bony prominences on either side, left and right. But we're going to use your abdomen, and the arm leads usually go on the inside of the forearm or the wrist, again staying away from bony prominences, but we're just going to put it on the chest at the moment. Okay, so now I'm going to attach the leads. Shouldn't take too long. You can just move normally while we're doing this, Mr. Jones. The only time you have to keep still is when we actually take the picture. So it stops any artifact or any interference. So I'm making sure that these dots are nicely stuck, which they are, making it difficult to put on. And all of these leads are labelled. So it says left arm and this one says right arm. So they are clearly labelled for anyone who's using this to see, to make sure you've got the leads in the right place. We have a left leg lead, and then we have a right leg lead, making sure that they're all correct. The machine will tell you if you've got the leads in the wrong place. It will detect it, but it's good to know what you're putting on in the first place. So for these ones, they are also clearly labelled. So as I told you, I've got V1 to 6. The numbers are there. They are also mostly colour-coded. The colours are usually the same on each machine. Sometimes they vary, but most of the time. So we've got V1 is red for this machine. We've got V2 is yellow. V3 is green, if I can get it on. And then we have 4, 5 and 6 coming on.
we have, there's 4 is blue, 5 is orange, and 6 is purple. So I'm going to put them on in the right order. Now, for the purpose of students doing this at home, as I go into teacher mode, you will be given, you've got in your take-home pack some orange dots. They will be able to mimic these ECG dots because you won't be attaching a machine. My left leg lead has dropped off, so I'm just going to make sure that stays on. And then we'll check the patient before we hit play. Now, most ECG machines will ask you to put patient details in. At this point, you can type in their name, their date of birth, and their UR number and press OK. It will allow you to complete the ECG and move forward. I'm just skipping that step on this one. It is now acquiring an ECG. So, back to Mr. Jones. I'm just going to get you to lay nice and still. You can breathe normally, but we just don't want you to have any movement at all. Otherwise, it will interfere with the picture. I'm just watching it on the screen right now, so just breathing normally. It's a beautiful picture, so I'm going to ask it to print. It's telling me that it's okay. I can see that there is no artifact on this ECG, and it will now print out. If I saw any artifact on the screen, I would actually hold it off and get it to take a picture again, and unfortunately I'd get the patient to hold still again. So, Mr. Jones, you can move normally. I've got a lovely picture of an ECG here. I just want to make sure that you have no pain at all.
No.
Good. Okay, I'm going to give this to the doctor. I can see that there is evidence of your arrhythmia, your AF, but it doesn't look like there's anything other than that on this ECG. So I'm just going to make sure I write no chest pain and pass this on to the GP, to the doctor. You okay there?
Yes.
Good.
Thank you.
All right, I'm just going to take all your leads off now so you're more comfortable.
Thank
Thanks.
you.